Good morning, everybody, and welcome to a very special edition of AM Buffalo. I'm Linda Pellegrino. Being that we're just weeks away from Breast Cancer Awareness Month, we want to help save lives by helping everyone stay informed about what they need to do and to discuss mammography and why it is so important. So for this, we have Dr. Ermelinda Bonaccio, who is the chief of the Breast Imaging Center at Roswell Park Comprehensive Cancer Center with us, and we have a very special 30 minutes to talk about this. So good morning, nice to have you back.
Thank you for having me back. It's my pleasure.
Let's talk about mammography. What exactly is it?
So a mammogram is a type of x-ray that looks at the breast tissue to find cancer, hopefully when it's small, and more likely we can treat it, lower the risk of dying from breast cancer, and treat it with less aggressive treatments, more likely to have a lumpectomy rather than a mastectomy.
All right. Who should get a mammogram?
So women at average risk should begin annual screening mammography at age 40. There are some women who are at higher risk that may have to start at a younger age, but that should be done in consultation with their physician.
Right. Why is it so important?
It is the only test that has been shown in multiple clinical trials to lower your risk of dying of breast cancer. The range is between 20 to 40% reduction in your risk of dying from breast cancer.
How often then, after that initial mammogram, should they continue having mammograms?
So this has been very confusing for patients because different organizations have recommended different ages to start and how often you should have a mammogram. But the bottom line is yearly mammography beginning at age 40 saves the most lives. That's when you maximize that mortality benefit.
Now, if you have someone in your family, you have a mom or a sister who had breast cancer, you're going to be most likely told, start getting them sooner.
Yes, especially if, like you said, exactly, a mother or sister will typically, especially if the family members are premenopausal, we will often start about 10 years before your mother was diagnosed or your sister was diagnosed. So if your mom was diagnosed at age 42, we would start at age 32. We usually don't start younger than age 30, and there are other patient populations that might also start at a young age. So it's really important, if you suspect that you're at high risk, to talk to your doctor, to possibly go to one of the high-risk clinics. We have one at Roswell that will give you a full assessment of your risk and then help you figure out when you should start having a mammogram and how often.
We talk a lot about mammograms, and there are some women who are afraid, thinking that if I go and have a mammogram, they'll find something, and that's not what I want to hear. It's important to understand most lumps in the breast are benign.
Right, exactly. Most women who get a mammogram are normal, but this is an opportunity where we can make a difference. If we can find a breast cancer early, you're more likely to live and also get less aggressive treatment.
Right.
You may not need a mastectomy or you may not need chemotherapy. So I think it's important to know that most mammograms are normal, but if there is a finding, if there is a small cancer, there are a lot of options for treatment of breast cancer, and we do very well with breast cancer. Most women who have breast cancer live.
They do fine.
Yes.
We also would like to tell you there's more tools at the ready than ever before, even with mammography. There is 2D and now there is 3D, which Roswell Park does have, and we're going to be talking about that. So what we're going to do is take a quick break. Dr. Bonaccio will stay with us. When we come back, we're going to continue this conversation with why you want to get your mammogram at Roswell Park. So stay with us.